Hi, Helena.
Hi.
How are you?
Good, thank you. Very well.
Hi, Daisy. Hello. Oh, why's got such a grumpy face?
She's like, I recognise you.
Yeah.
Daisy's not really a fan of the vets. She's quite a grumpy bulldog. So when it comes to like prodding her and poking her, if she's not in the mood, she just won't let you.
And what's she in for today?
She started to have like tremors, her head shakes.
Okay. Right.
I've got a video as well to show you.
Okay.
Of her doing it. She's done it like 4 times now.
Okay.
In the last 2 weeks, just randomly, her head will shake really fast, but for around about 5 or 10 seconds. And I literally just grabbed her chin because I thought maybe she's having a fit or something, but it was quite hard to see when you can't do anything for your dog.
Okay, well, let's go into the consult room and have a look at the video.
Okay, perfect.
Come on then, gorgeous. In you come.
Obviously, 8 years is a long time for me to have a dog, and it's always just been me and Daisy. So it's a little bit nerve-wracking to know what's actually wrong with her.
Okay, let's have a little look at this then, shall we? Oh, wow. It's quite significant, isn't it?
Yeah, it's really fast.
And then I can see her eyes just blinking a little bit, sort of what we call muscle fasciculation, so little sort of tremors around the muscles of the face alongside this head bobbing. And I can hear her snoring.
She goes straight back to sleep. And that's the thing, it's not hurting her or anything.
Yeah. I mean, you would be inhuman not to be worried about that.
No.
You know, that's a strange movement. Yeah, that's quite worrying. Any dog owner knows that when their dog's asleep, they can make some funny movements and basically dreaming. But in this case, it was much more sinister looking. It was a real shudder. And the fact that this is coming and going, not only when she's asleep, but when she's awake as well, is quite worrying. And generally, is she a healthy girl, eating well, drinking normally?
She loves her food.
Yeah.
I've noticed she's drinking a lot more.
Okay,
So
that could be playing a role.
Oh, really? Oh, I didn't realise that.
Yeah.
Is kidneys something to worry about?
It's not a great symptom.
Okay.
If she has kidney disease. So, yeah, it's definitely something we need to look into. Yeah.
Sorry.
It's okay.
Okay.
Oh, you're all right. She's your little girl, isn't she? Yeah. Renal disease or kidney disease can sometimes lead to symptoms like head tremor in dogs. And poor Helena, well, obviously, she's understandably shocked. She clearly adores this dog, and it's not something that any owner wants to contemplate. It is something that is seen in other British bulldogs, that they just have this little bit of a head tremor.
Yeah.
And what we need to do is to diagnose based on exclusion. So we have to rule out a whole bunch of really frightening, really horrible things. And by the time we get to the end, what's left is idiopathic head tremor. But obviously at the other end of the scale is the possibility that she could have a tumour in her brain.
Yeah. Okay.
So what we're going to end up needing to do is to sedate her in order to take the blood, which we need to just check her general health, and also to look into why she is maybe drinking a little bit more than normal.
Yeah.
What we'll also be doing is then x-raying her head and her, basically her spine, just to see if there's any abnormalities, anything that could lead to the symptoms that you're seeing.
Okay, perfect, thank you.
All right then, you say goodbye to Mummy, all right?
Thank you.
We're going to go on our little journey of discovery together, aren't we? Yes, we are, yeah.
It's really hard to leave her behind. It's horrible to leave what I class as my baby behind. We have that connection, so it's hard. I don't want nothing bad to happen to her, but we'll just wait and see.
All right.
Thank you.
No. I guess she's still learning how to play, isn't she? She doesn't really know.
She's not quite grasped it yet.
No.
She'll get there.
In a nearby park in St Margaret's, Scots vet nurse Reagan and her partner Russell are trying to encourage their newly adopted dog Shiloh to play.
Go on, Shiloh. Fetch.
Go! My grandmother actually sort of posted something on Facebook for a rescue centre. I always wanted to rescue, and I just feel really strongly about adopting. And seeing her picture just come up, like she does have such a foxy little face, and that did instantly draw me to her. And I literally showed it to you straight away, didn't I? And I was like, that's that one, definitely.
Yeah,
The
unbelievable. Haven't seen anything like her before, so yeah, she's one of a kind.
Shiloh!
The shy little pup has had quite a journey to her new home. She was saved by Florrie's Friends, an organisation that rescues neglected and abused dogs and cats in Romania and brings them to the UK for rehoming.
Good girl.
Good girl, can you sit? Good girl. Dogs in Romania do go through a bit of a hard time. I know that she was taken off the streets and put into something that they call a kill unit. I believe they just round them up and sort of dispose of them, really.
I feel nice. Living the high life now. At first, you could tell she was just scared of everything. Like, you take her out for a walk, she'd just lay down when she saw people, tail between her legs, literally scared of the world. But now she's started coming out of her shell, like happy around people, tails wagging.
Come on, baby. She's completely stolen my heart. She's just so beautiful and just so kind and gentle, and I know that she's got a really good soul. She's doing so well. I'm so pleased.
Yeah.
That's how she's doing. Oh, look at her face.
And today, little Shiloh has another adventure in store. Reagan is taking her into the Isleworth Practice for her very first checkup.
Hey, baby.
You're the best girl.
Left a bit, right a bit, left a bit, left a bit. Oh, yeah. Oh, that's the spot. There we go. You're a big flirt, aren't you, eh? Oh dear, as soon as Mummy's out of the room, butter wouldn't melt, eh?
It's like X-ray me, Scott.
Yeah.
At the Richmond Practice, Scott and vet nurse Jess have just sedated English bulldog Daisy.
Well, she's got his head tremors, so she's got a strange sort of up and down shake of her head, which is quite concerning. Happened quite a few times over the last month.
Oh, Daisy.
Head tremors can be caused by a variety of things, but Daisy's owner has just said that she's been drinking a lot of water lately, and that makes me think about kidney disease, which can be deadly. So straight away, we can hopefully rule that out by testing Daisy's blood and urine.
Oh, sweetie.
Go.
Go from there. Hey. Wasn't lying about your snoring, was she? It's pretty impressive.
Upstairs, Daisy's owner Helena is hoping it's not bad news.
I think your head goes through so many different things of all the worst possibilities, but I don't know, I just think I've just got to think positive.
Right, let's have a look at these bloods then. That's all looking pretty good. So kidneys are fine, just fine, which is really great. Yeah.
It's a relief.
Let's just check the urine test that we did as well. Great. Yeah, I mean, she looks like generally a very healthy dog, so far, so good.
Keep it up, Daisy.
Yeah, exactly. It's great news. Daisy's kidneys are fully functioning, but she's not in the clear yet. The next step is to take some x-rays. X-ray to see if there's anything wrong with Daisy's skull and spine, any abnormalities, any pressure that's being applied to her spinal cord that might be causing these head shakes. Just having a little look around her head. So far, so good. There isn't any obvious changes. The start of the cervical vertebrae in the neck I can see, and they're all looking normal. It still, however, does leave the possibility that it could be within her brain, something that we can't see on an x-ray like this. With all the tests complete, Daisy's beginning to wake up from her sedation, and it's time to reunite this lovely bulldog with her beloved Helena and give her the good news. But unfortunately, I can't rule out all the bad things just yet. You're right there? Can you hear Mummy? Where's Mummy? Where is she?
Daisy.
Who's that? Who's that? Daisy, look, who's that?
Hello, princess. Hello, Mummy.
Hey.
Hello.
So, lots of information gained today.
Oh, really?
All right. But one bit of news that I know that you'll like is that she doesn't have kidney disease.
Thank you. So I sort of want to kiss you, but I'm not going to. Don't worry.
Well, we can hug.
Yes, thank you. Oh, thank you so much. Thank you.
You're welcome. So then after some tummy rubs and some x-rays, I've not found any cause for the tremors. So there's nothing that is of concern as yet that I can see. The only thing left really is the possibility of there being something within her brain.
Okay.
So either inflammatory diseases, swelling, or worst case scenario, a tumour.
Yeah, I know, yeah.
So we need to send you off to the Royal Veterinary College. She needs to get an MRI done. That will look into her brain and see exactly what's going on. And if there is any negatives to find, they'll find it.
Okay. Just keep our fingers crossed.
Exactly.
You gonna get up?
Hey, should we go home?
No.
You want to come? Come on, then.
And Helena, I really hope that we're going to get good news from the RVC. Yeah.
Thank you so much.
Good
Thank
luck.
you.
All right
Thank you.
then.
Come on, Daisy.
Bye, girls. Bye, gorgeous.
Bye. Good girl. Good girl.
I'm gonna go in and say hi to everyone.
Vet nurse Reagan has arrived at the Isleworth Clinic with Shiloh for the little rescue pup's first health check.
Hi.
Oh, this must be Shiloh.
This is Shiloh, yes. Oh, look, she's already waiting for a treat.
My God, hello, sweetie pie.
She's so beautiful.
I know, she is really amazing, isn't she?
It's the first time receptionist Lizzie and vet nurse Lily have met Reagan's new pup.
I didn't expect her to be so confident.
I know, she's done really well with people. She was very nervous at first, but she still is now, but definitely getting better. Oh, that's cute.
Yeah.
Good girl, baby.
Hey.
Hello. Oh, is this your new little puppy?
This is Shiloh, yes.
Hello. I've heard so much about you.
Shiloh is booked in for an appointment with vet Phoebe.
So I just wanted to bring her in and get her checked over, make sure everything's all okay.
Shiloh's got an amazing story, and then this is the point at which hopefully her whole life turns around. She goes from being a dog on the street to a dog in a loving home with a vet nurse as a mother, so she'll definitely get the best care. I'll start with the head end and I'll work down. She's made herself at home on the table, hasn't she?
She's pretty comfy, yeah. I don't think she minds too much.
Let's have a look in your mouth. Yeah, teeth look good, no gingivitis or anything. There's a tiny little bit of tartar on there, but not much at all.
Good.
Let's have a little listen to your chest, Puppet. She's really good.
She does have all these lumps on her head. I was informed that it was because of a dog bite while she was in her kennels when she was in Romania.
There's this big one here.
There's one there. There's one just at the front, I think.
There's one, oh yeah, there's one here. In some places it even looks like scar tissue.
Yeah, it's like growing over the fur there, so it's a little bit strange looking. All right, baby.
I think they look like cysts, little follicular cysts. Okay. So that does fit with a history of trauma. Sometimes it can bring on these things.
Okay.
I think they're unlikely to go away on their own though. But if we did take them off, it would be quite a straightforward operation. She'd need a full general anaesthetic, but she's young and otherwise healthy, so I can't see why she would be at high risk or anything like that.
So what's your verdict then?
Reagan, she's in really good health.
Good.
Yeah, she's really good. It's just these tiny little cysts on her head, and I think you just need to have a little think about what you really want to do with them. I don't think there's any rush.
Okay. The only thing that I'm worried about really is if she catches it while scratching, or if she's playing with another dog and they scratch it, could cause an infection, make them quite inflamed, and just more problems really than they are now. So I'm just deciding whether or not I want to go ahead with the surgery sooner or wait for a little bit.
You've been very good today, haven't you?
I'm very pleased with her, yes. So got to get her home now and carry on with the rest of the day. Hey, Shiloh.
Hey.
Scott's now heading 2 hours north of London to answer an emergency call from the Leicestershire Wildlife Hospital.
I'm really excited today because, of course, at my London practices, I'm generally working with domestic animals. So when I get the opportunity to work with wildlife, I jump at the chance. Well, hello there. You must be Angie.
Hi, Scott.
Oh, I'm Scott. How are you?
Scott. How
nice
are
to
you?
meet you. Very good.
Angie set up the rescue centre 30 years ago, and it's currently home to 500 animals in need.
We've got swans, badgers, foxes, mainly hedgehogs as well this time of year.
Okay.
And then talking of hedgehogs, we've got a poorly one, if you could have a look at it for me while you're here.
Wow. You didn't take long to put me to work, did you?
I didn't. Come on in.
All
Come and
right,
have a
let's
see.
go. Crack the whip.
Hi, Harriet. This is Scott.
How are you? Hi, I'm shaking hands with you as you're supposed to be holding on to your patient.
Yeah, bless. So this is the emergency. It come in literally a couple of hours ago. She's actually got quite a swollen mouth.
That is nasty looking, that really swollen, ulcerated tongue.
Yeah. Scott arrived just at the critical moment for the hedgehog. She's very, very dehydrated, very skinny.
The person that dropped the animal off, do they have any idea what?
No, they were just driving past, seeing it on the side of the road. In the daytime, obviously, they're not supposed to be out in the day, and picked her up and brought her in.
This little hedgehog, she's clearly unwell. She's got a really swollen, ulcerated tongue, and her mouth just looks so painful. I don't know if it's just going to pop out or not. Right. So that tooth is moving there. That molar is actually loose. So
yeah, I can see it.
I don't know if it's what she's eaten has then weakened the gums around it, but that's where this muck is coming from, is from that tooth. Not only does she have a huge amount of sort of bloody, pussy discharge, but finally I can find the root of the problem, which is a tooth root abscess. Just gonna see if I can go underneath the tongue if she'll let me. There we go. Out it comes.
Oh,
There
wow.
it is. Look. The poor thing. Oh, baby girl.
The hedgehog's gums are so badly inflamed that the tooth comes out easily.
That is going to make all the difference in the world, because that would have been painful, but obviously would have been a site for infection. So I think now we've
And
got
obviously,
that
if you
out.
managed to clear it up as well, because it was still in there, you could obviously get another infection.
Yeah, that's it. I just think when you've got a tongue that sore,
Yes.
you're not going to eat.
No,
and
no,
therefore you're going to
definitely
get
not.
dehydrated
Yes,
and
yeah.
anorexic very quickly. So I think you might just need a little bit of fluid under your skin, sweetheart. She just needs some hydration. She's very dehydrated after a time not eating, and some antibiotics to start knocking off the infection. She's not giving up any fight at all, is she?
No, bless her.
So flat.
Hopefully it'll make her feel better, though.
So now that I've treated my patient and I'm just about to give some medication, I think she deserves a name, don't you?
Yes, yeah. I mean, what sort of thing would you like to name her, since you've,
I'd love to, yeah. I mean, like a good English name, I think. Like maybe like what about
English name.
Hattie the hedgehog?
Hattie the hedgehog. Yeah,
that all right?
I agree with that. Yeah, if you want Hattie the hedgehog, you can quite happily have a Hattie.
Bless you, thank you.
Hattie.
Hattie is a really unwell hedgehog right now, but what she needs is lots of love and attention and lots of treatment. So hopefully by being here now at the hospital, she'll be able to get all of that treatment and hopefully make a full recovery. All right, gorgeous. You feel well soon. Toothache really is quite painful, isn't it? There you go. All right, get nice and snuggly. All right, to our next patient.
Yes, fab. Thank you very much.
Yeah.
So I've got another little something to show you.
Okay, all right. I'm intrigued.
With hundreds of animals in care at the sanctuary, feeding time is especially demanding.
Oh my word.
So every spare set of helping hands is put to work.
Hello, beautiful. Hello. Oh, wow.
The two bunnies that we've got in at the moment came off a building site. The foreman brought them in after seeing a digger dig them up. So they're being hand-fed by me. So lots of hours going in there, lots of sleepless nights. I was hoping that you could help me feed them.
Oh, I'd love to. Absolutely love to. As a dad of three, I'm used to giving babies milk.
Experience then.
Yeah.
Just need to check, obviously, that it's not
Yeah.
too warm, which is fine.
Yeah.
So if you want to take that one.
You hungry? There you go. Oh, look. Say, this job just never gets old, does it?
No, especially, when the babies come in, it's lovely. Definitely got the wriggle on.
Yours just staying there.
Yeah.
Eh? Maybe it's just a experienced touch. Eh?
He knows if he wiggles, you don't get that much.
Look at us like proud parents.
Yeah.
Harriet's demonstrating such a massive dedication to her job. She's getting up to these little kits every 3 to 4 hours throughout the day and night, making sure that they're given all the milk they need to sustain their body weight and hopefully get to the point where they'll be able to be released back into the wild.
Yummy.
Well, mine's finished his.
Aww.
Is that all of his?
No, it's not a race.
No, well, I won.
Good girl. Daisy.
Just north of London, Helena has arrived at the Royal Veterinary College, hoping for answers as to why Daisy is experiencing head tremors.
So Daisy's having an MRI scan. We're just going to check, see whether there's anything in there, like a tumour or anything like that.
In. Yeah, good.
To be honest, it's only just hit me as I walked in. I think you put it at the back of your mind, else you just go mad thinking, what could it be?
Scott has already ruled out kidney disease or a spinal problem as possible causes of Daisy's head tremors. So the MRI will now be focusing on her brain.
I'm hoping the best results come and she's fine and we can go home. But I don't know. I'm a little bit.
Specialist Elsa Beltran is looking closely for any abnormalities.
At the moment, nothing. Hello, good evening. So Daisy is recovering from anesthesia. She's doing very well, so we can come in and then we have a chat of the findings that we have found on the MRI.
Okay,
it's okay?
Perfect. Thank you.
So we just go
This
to the
back that way
consultant room.
again.
Yeah. We don't have anything in the brain to be worried about regarding the head bobbing. So at this stage, everything looks very good.
So there's nothing to worry about?
Nothing to worry about. So good things.
That's good.
If you have any problem at any time, you give me a call, you send an email, and
Thank
I'll
you,
reply.
yeah.
And there she is.
I know, monkey. That is the best feeling ever. It's been so stressful the last couple of weeks, just not knowing. So to hear that's really good. Let's go home. Yeah. Good girl.
The next step for Helena is to discuss the RVC findings with Scott.
Daisy, come on. Yay, let's go home.
So you've seen some of our nicer animals now.
Yeah.
Now I've got something more on the feisty side to show you that needs a quick check over.
Okay. Sounds ominous.
Yeah.
At the Leicestershire Wildlife Hospital, Jack, the birdlife carer, has an unusual patient for Scott to meet.
Wow, so it's a kestrel.
Yes, it is, yes.
Oh, my goodness. He is an absolute stunner, isn't he?
Yeah, he's very lovely, yeah, but he's quite feisty as well.
Well, I can imagine. They're those birds that when you're driving up motorways in the UK, you always see them sort of stalking their prey, kind of hovering above. You're thinking that vole better run pretty fast.
Yeah, they're the ones that hover, yeah.
So why is he here at the hospital?
So a gentleman just found him out walking his dog kind of just in the middle of a field on the ground, and he wouldn't fly off.
Okay.
So the gentleman brought him into us, and he's now just checking the wings are okay again, and hopefully test flying him if everything's okay.
So I suppose we have to catch him.
Yeah, best get him out.
Yeah. I think you're the experienced one here. I think you should go for it, mate. Yeah.
I'll take one for the team.
Yeah. Thanks, mate. All right, going in. Oh, well done. Well caught. Oh, wow. Hello, mate. Oh, that's perfect, putting that little tail on his head, just like a hood for any raptor, just calms him down. Darkness and peace. Okay. Yeah. Which wing was the one that you think is working?
Right wing that he seemed to
Okay.
use as well.
Wow. This is literally the first time I've ever got to open a kestrel's wing. It's such a privilege, isn't it?
Yeah, it's not many people get the chance to hold a kestrel, let alone touch one.
The good news is that I can't feel any fractures, any broken bones anywhere in the wing, which is great and backs up what you guys thought. One thing I can see, however, is that right at the end, this little flight feather here, the primary flight feather, is actually damaged there, and it's a little bit kinked, and I think that was probably sustained maybe with trauma. So the bird's come down as a result of that. And then maybe he's just got out of the habit of flying. Flight feathers are obviously very important to allow a bird to twist and turn in the air, but also to lift off the ground. So for this bird to have a sudden change in the way that its wing works, I would suggest that's the reason why it's come to the ground and then not wanted to fly off again. I just want to have a feel now of his pectoral muscles, his chest muscles, because what sometimes happens in birds when they're not using their wings properly is that one pec will be, well, a little bit flat, and the other one's nice and solid. So I just want to see how they feel here on him. Again, it's good news. His keel bone, the breastbone, isn't particularly sharp. He's got good musculature. He's got a nice muscly chest for a bloke. Yeah. And both of the pecs are equal. So I think that this is an acute injury. I don't think he's had this loss of flight for very long. And I'd hope that just a bit of rest and TLC with you guys should be enough to have him flying again. Obviously, the trial flight is a difficult one. Have you got somewhere we can maybe try and
we have
do?
Avery where we can test fly him in and see how he gets along. It's very important that the kestrel's wings work into 100%. It's essential for its life in the wild that it's fully functional. Without it, it'd be grounded and it won't be able to hunt or survive for food.
All right, little man, let's see what you can do.
Yep.
Hey, look at him go. Hey, that's brilliant.
Yeah, much better than when he originally came in.
This is a healthy bird. He's flying, he's flapping around the cage, he's moving very well. Oh, he's doing great. I mean, he's still flying a little bit off kilter, I think, with that flight feather being damaged, but hopefully he'll get used to that in time and be able to be, well, certainly go into a larger aviary, maybe?
Yeah, definitely. So his next step now that he is flying, he will go into one of our aviaries to build up more of his strength, and once he's ready, he'll be released back where he's from. It's a much better result than we ever could have thought. So fingers crossed he won't be with us for too much longer, even though we're seeing him around.
Next day, Scott is back from Leicestershire and is visiting Helena and Daisy to discuss the bulldog's diagnosis.
Oh, someone's home. Hello, how are you?
Hello, baby girl, how are you? Got some MRI results to discuss, don't we? Yes, we do. Yes, we do.
Fingers crossed it's the final sign-off and Daisy hopefully won't be visiting the vets too much more.
The report is all good news, as you know. It's good news. What are you growling for? It's all good news. In that these head tremors are classed as idiopathic, which just means of unknown cause. So, you know, this bobbing, rather than thinking that it's some sort of condition that we should be really concerned about, instead now you can just say it's a very cute little quirk that Daisy's got. One little bit of homework that I'm asking Helena to do with Daisy is to keep a diary, and anytime she sees any of these tremors, these head bobs, to just write it down, how long it went on for, and if Daisy was okay afterwards. And also, I'd like her to just try to interrupt the behaviour, because if she can stop the bobs by getting Daisy's attention, then clearly that is not a seizure and there's nothing to worry about. Maybe we can interrupt it with a tummy rub, because we know how much you love those, don't we? Hey, just don't stop. Just don't stop. It was clear from the outset how much Helena loves Daisy. These girls are bonded. She absolutely adores her. She wants the best for her, and that's why we've gone through this whole process to make sure that these concerning symptoms are nothing to worry about.
Just kiss him to say thank you.
You're very welcome. You're very welcome. But we might have to do something about that breath.
Yeah. Oh, bless her. Good girl.
Girl.
Good girl, this way.
In Richmond, Nurse Reagan is bringing Shiloh in to see Scott after the little rescue dog developed a problem with the cysts on her head.
She scratched her head and it made one of them bleed quite badly. So I just want Scott to take a look at it and give his opinion. So I was told that she was bitten by a dog when she was in the shelter, once she'd been rescued over in Romania, and they were just cysts that had come from that dog bite.
Has there been any other symptoms at all? Has she been unwell? Has she had a fever?
No, she's absolutely fine, eating normally, going to the toilet normally. There's no other problems, so
Okay.
seems like it's just in that area.
Yeah, yeah. And did they actually see and treat the dog bite, or are they just guessing that it was?
I had a picture sent of when she did get bitten and her head was really swollen. So clearly they were there right when it happened and they did treat her straight away.
That's good, because one of the problems we see in rescued street dogs in Europe is a condition known as leishmania. You might have heard of leishmania. It's a protozoan disease and it's spread by sandflies. Now, normally in Romania, they don't have a huge amount of beaches or sandflies, so it's not normally a problem, but they have started to see migration of the sandflies and they have seen some cases.
Okay.
It's not great if they get it. Leishmania causes a whole bunch of different clinical symptoms. Mostly it starts as skin lesions, so scabbing lesions around the head or the face, which is why I'm concerned for Shiloh. It can also lead to lameness, it can cause fever, it can cause all sorts of symptoms, but it's a lifelong, debilitating condition that has no cure. And it can have ramifications for the rest of their life. I'm sorry. Yeah. Unfortunately, when I worked in Portugal, I saw a lot of street dogs and they show symptoms like this, and leishmania is very common in Portugal.
Didn't expect that. Just thought we were going to remove the cysts and then she was just going to carry on as normal, but now this has sort of come into the picture. It's sort of thrown me everywhere.
Today, what I think we need to do is to give her an anaesthetic, clip her head, and have a look at these lesions and see what we can do about them. And then we'll take some bloods. We'll likely send some of the skin lesions off as well to the lab and, well, prepare for the worst and hope for the best.
Yeah, okay.
Yeah. Hey, Jess.
Morning. Hello.
So have you met Shiloh before?
I have. Hello, baby. How you doing?
Reagan will be an observer during the surgery, and Nurse Jess will be assisting.
Hello.
Even though it's nerve-wracking because it's my own animal, I'm just really trying to stay positive and keep our fingers crossed.
If it was a dog bite, it must have been a horrific one.
Yeah.
It's incredible sort of what lies beneath the fur. Looking at these lesions, straight away you think, a dog bite? Really? Nodular, sort of dark pigmentation also is something that's a little bit concerning. But what we have to be careful of is as soon as we take some away, we're putting tension on the skin and our eye's just there. Yeah. So what we don't want to do is irreparably change the appearance of your dog's face.
No.
Okay, so just cutting now, Jess.
Cool.
So what I want to do first is just investigate one of these nodules.
Was that what was underneath the skin?
Yeah.
Oh, yeah.
Wow, I think I know what this is. I bet you can't guess what's going to be in
What? Don't. What?
here. Look.
Was that what was underneath the skin?
Yeah.
Oh, yeah.
Wow, I think I know what this is.
In Richmond, Scott has just discovered the reason for the nasty lumps on rescue dog Shiloh's head.
I bet you can't guess what's going to be in
What? Don't. What?
here. Look. It's hair.
Okay. Is this a good thing?
It's a very good thing.
Okay.
So what's happened is during the bite, the hair has been bitten into the wound and then the wound is healed over. So all of these lumps and bumps is hair. Look.
Oh my God.
It's gross cool, that is. That's gross cool. So that's really good.
Yeah.
Yeah.
That's amazing. God, there's so much of it though. That's like a really vast area.
So I'll have to mine into every single bit of it.
The discovery of the hair means Shiloh does not have the potentially fatal disease leishmania.
I can't actually tell you the relief that I feel right now. It's like the best news I could possibly have wanted.
So you can see them, so they're all dotted in. So there's more hair, more hair, more hair, more hair. It's just gross. Hairy little mutant babies all through the dog's head.
But that's made me feel
Look.
a lot better.
Some of those little hairy volcanoes. Now out. There you go. So you can really see them there, Reagan. They're unbelievable. So there's one there, just all the way through, all those black dots. I can feel a big one in there. So if we just cut over that. Ugh.
Oh my God.
Oh, big one.
Oh,
Gross,
that's
eh?
horrible.
This isn't something you see very often at all, and not to this extent. However, disgusting, it's good news, and I can remove it. Happy days. And we'll zip her up, and she'll look like a real rock chick, won't she?
Yeah.
And that, ladies, is that all those nasty little hair volcanoes out of your gorgeous dog's head, and she can wake up.
Baby. Hi, Shiloh. Hello. Hi.
Now the surgery is completed, Shiloh is allowed to recover, and she does that very gently, and now it's time for her to have lots of cuddles and lots of reassurance from loving Reagan. So while you continue to rest, let's get back to work. We've got a busy day, lots of patients to look after, so that theatre won't scrub itself.
Okay.
Off you go.
Thanks, Scott.
Come on then.
2 days later, Scott is answering another call from the Leicestershire Wildlife Hospital, this time to check up on a swan called Lucky.
So the famous Lucky's in here?
Yeah, he's just in here, yeah.
Yeah.
Lucky came here at just 3 weeks old, when he was found with a shocking crossbow injury to his head.
Lucky was in a terrible state when he came in. It was so traumatic. We weren't too sure whether Lucky would pull through or not. It was really sickening just to think that someone could be so cruel and do that to such an innocent baby animal.
Miraculously, Lucky survived and has been nursed back to health.
When I see animals treated with such cruelty, it angers me to my very core. It just drives home the importance of the wildlife warriors like the people here at the Leicestershire Wildlife Hospital. If it wasn't for them, animals like Lucky that are treated so badly just wouldn't have survived.
Lucky is now a year old, and after spending almost all of his young life in care, he's hopefully recovered well enough to be released. But first, Scott has to give him the all clear.
I must admit, I am not a swan wrangling expert. So can you just give me a little bit of advice on how I should be trying to scoop up young Lucky?
So we'll try and round him up, and then usually if you can get them round, grab the base of their neck,
okay.
And then we'll keep the wings close to the body so he can't flap.
Okay.
Just watch out for the feet because their claws are quite sharp.
Right, okay, so watch out for feet. I'm assuming the beak.
Yeah, and wings.
And wings.
Yeah.
Wow, it's quite dangerous, this whole swan wrangling malarkey, isn't it?
Yeah.
Feeling a little bit nervous. Okay, Lucky, be nice. Oh, my goodness. All right, sweetheart. Wow, okay. Ooh, you are large, aren't you? Ooh, wow. It's stunning, isn't he? And surprisingly, you can't even see a hole.
No, there's a slight indentation in his skin, but with the feathers covering it, you can't see it.
Yeah. Having a look at Lucky's beautiful face and head, you'd never know that he'd been shot with a crossbow through his head, but I can feel the indentation, and you can feel how close it went to his cranium, which is the bony structure around his brain, and a little bit further forward, and this swan wouldn't be here today. That must have missed his cranium by millimetres.
Yeah, it was a millimetre that it missed him his skull by, so yeah, he's very lucky.
Hence the name. Wow, well, I mean, that seems to have healed really well. No problems there whatsoever, and all the feathers are covering in what is that rather impressive dent in his head. But the foot is what you're concerned about, isn't it?
Yes, so it's just this foot.
Oh, right, I see, here, yeah.
Look, he came in with a slight swelling on his right leg, and it's kind of stayed there. It's never really got worse, but it's just something we wanted checked out before he's released to make sure it's not going to hinder him when he's in the wild.
There's that swelling on the right leg, but it's not there on the left. Has he ever been lame?
Not truly lame, no.
Okay. Yeah, because generally if they have bumblefoot, it's quite painful. It's red and it's swollen, and actually the animal's quite uncomfortable, but Lucky's not really batting an eyelid there, are you? To be honest, there's good flexibility there.
Yeah.
There's absolutely no pain or discomfort. There's no swelling or redness. There's no discharge. So, yes, it's definitely different from the other side.
Yeah.
But if it's not causing him any functional problem, I don't see any reason why you can't finally be released.
That's great news.
And he seems to like you a lot, Jack, and you must have developed quite a strong bond over a year, because that must be a long time for any inpatient.
Yeah, he's probably one of the longest patients we've had. So yeah, we've got a bit of a bond, probably more love-hate relationship, but I really like Lucky, but he probably hates the sight of me now after everything he's been through.
It's been a long road to recovery for the young swan, but a clean bill of health means he'll spend a final night at the hospital before being released back into the wild tomorrow.
He's making me nervous right there. You said be careful of the beak, and now I know why.
Yeah.
At least buy me a drink first. Seriously.
The next morning, it's an early start for Scott, Jack and Harriet. And it's Lucky's big day.
You seem a bit emotional today.
Thank you.
You all right?
Yeah.
Your little boy's leaving, flying the nest.
He is indeed flying the nest.
Today's a really exciting day. Lucky the swan, after over a year's worth of rehabilitation here at the Wildlife Hospital, it's time for him to be set free. Come on then, should we go and find you a lovely big reservoir to swim in? Yes? Let's go.
Lucky is being released along with another swan that's also been rehabilitated.
There's Lucky. Okay. Come on then, the moment of truth. Hey? Come on, let's go and see Uncle Lloyd. Hey, he's got a lovely bit of leg jewellery for you. Hey? So here is the man of the hour. This is Lucky.
Let's give him his leg ring. So we've got that unique number.
Yep.
That's going to be Lucky's number now. We squeeze that on, and then hopefully the next time we hear about Lucky, he's doing something good, maybe back breeding and got young again and
that would be
doing
incredible.
Well. So
yeah,
here we go. That's all done. So Lucky is ready to start his life again.
Come on then, Lucky. Let's go.
Lucky.
Let's go.
Yeah, it's been a long time coming, bless him. It's been a year, so...
Such a long time. Look at that. That's what freedom looks like, hey? Must be an incredible moment for you guys. Oh, you've done such a great job. I'm so proud of you. It's amazing. Oh, bless you. Lucky, say goodbye.
Come on, look, let's get you gone.
He's had a new lease on life because of you. Look how excited he is. Look. Yeah.
Come on, then.
Come on.
Hey?
You're making people cry now.
Yeah.
Come on. Let's let you go and enjoy yourself, shall we? What do you think?
Good luck. Don't get yourself in any trouble.
Yeah, good luck. Watch out for crossbows. All right. Ready?
Yeah.
Wait a minute. Nope, it's under you. There you go.
Come on then, Lucky Lou.
Off you go, mate.
Oh, step there.
Good luck, buddy. To sort of see them now back into the wild where they belong, you must be chuffed.
This is why you do it.
Yeah.
Feeling's fantastic, but it also feels like your babies have left the nest.
It's an incredible thing that you do for wildlife, because you put all this effort into them and you don't expect anything back. What you expect is to see what we see today, which is them enjoying their freedom.
Yeah, all I really expect is them to be back in the wild where they belong.
Yeah.
That's what I do it for, so...
You got your wish?
Yeah, definitely. Lucky really is like the true dream story of like why you do this job, and just to see such a sick animal come through with such a horrific injury, to completely turning him round and letting him be released back into the wild is just amazing, and it really is what the job's all about.
It's been such an amazing few days up here in Leicestershire. I've loved working with these incredible wildlife warriors. It's such inspiring work they do, and I'm just really happy to have been a part of it, and I hope I'll be back very soon. Today, I'm on my way to North London to do something that's really important to me. The rescue charity All Dogs Matter have asked me to come and visit their kennels to check out some new arrivals.
Waiting at All Dogs Matter is Ira, who founded the rescue charity.
Hey, Ira, how are you? Good to see you.
Yeah, you too.
Big day.
Like the jumpsuit.
Oh, thank you very much. Well, I'm kitted out, ready to go for a very big day. I hope our Korean dogs have travelled well to the UK.
Yeah, it was very exciting. Just waiting for them to arrive.
Kennels have been especially prepared for 12 very special rescue cases that are arriving all the way from South Korea.
So the dogs arriving today have been rescued from a meat farm. They are dogs that are either bred for their meat, or they're often stolen, or they're ex-pets that have been picked up. They're kept on these farms, fattened up, and then once a year there's the Yulin meat festivals, when these dogs are basically tortured and killed, and it's horrendous. They're like death camps, really. The Korean government and lots of, young Koreans are obviously anti this now. They're working at closing most of these farms down and rescuing and taking out most of these dogs.
Dogs are complex, emotional, sentient beings, so they understand what's going on around them. So the thought that these poor animals live a life where they're unloved, and when it comes to their final moments, they see what's going to happen to them. It's just, you just can't bear thinking about it. It's awful.
These will be the first Korean meat trade dogs to arrive in the UK after being rescued by the charity Humane Society International.
So we're looking quite shy, a little bit traumatised. Hello.
London-based All Dogs Matter has been entrusted with finding them new homes.
To be able to make just even the slightest bit of difference and have a connection that makes them think, you know what, maybe people aren't horrendous, which they must think right now. Hello, buddy. Welcome to Britain. And I hope that these dogs might finally see a good side to people. It's just awful to think this is the first time he's been shown true affection, isn't it?
Well, absolutely. I mean, the trust that they give, considering how they're treated, is just, well, I think maybe we can learn some lessons from them.
Well, let's get you somewhere nice and warm, shall we? We've got a lovely bed set up for you. My job today is to examine them all, make sure that they have survived the journey okay, and they're given their first set of vaccinations.
Each dog is taking to its environment differently. While some seem relaxed, others are a lot more fearful.
She won't bite. Poor Lulu, she's obviously seen a hell of a lot. She's one of the most nervous. She's petrified. She won't make any eye contact, won't look at you. She just doesn't want to see anything of the world. I mean, just wonder what she's seen in her little life.
It's so upsetting to see, isn't it?
It's really, it's more upsetting now I've met them.
It's really got to you, hasn't it?
Yeah, now I've met them. Yeah.
It's very clear the damage that has been done by these dogs being in the environments that they've been in back in Korea. These dogs have had no upbringing, no socialization, no training, no fun, no joy, and as a result, they just have nothing to give.
She's completely broken down. She's just frozen.
Lulu is clearly severely traumatized. What's going to be the hard part is teaching this beautiful dog to be a dog again. We do need to take a different approach when trying to examine dogs like this, because you simply have no history, and if anything, you know that they're from pretty bad beginnings. So they're going to be nervous, some of them fearful, some of them aggressive as a result of being fearful. So it is a case of just gently moving forward, doing the best for them, but trying to appreciate the traumas they've been through. A little feeling of what freedom feels like, sweetie.
She's so sweet.
Abby is the first dog Scott will be treating.
The funny thing about dealing with Abby is just she's actually quite friendly. Yes, she's timid and she's nervous and she's shy, but she's not aggressive. And you think, you know what, after what they've been through, if they were trying to bite my face off, I'd understand it. But yet she's still got room in her heart for affection, which is just so desperately sweet.
A little bit unsure of noises.
Well, I suppose in her past, those sorts of noises could have meant death. To think they might have actually seen...
Being grabbed out of the cage. We're sitting here now, someone can come in and grab her out.
And kill her right in front of their companions.
It's not worth thinking about. But sadly, it's a reality and it's happening. We just need to stop it happening.
Yeah. And for this little girl, she just needs to learn that she can be safe and confident here and no one's going to do that to you. It is a real privilege today to be the vet for these dogs. Okay, Abby, so you're going to be a brave girl. The first vet in the UK to examine them, give them a vaccination and then help them on their way. Hey, that's the first step to your forever home. Yes. I was really gearing myself up for a really difficult job today, that these dogs would really make it hard to get these vaccinations in them to start the process of a healthy new life.
Good girl.
Good girl. But most of them, friendly, sweet, just thoroughly gorgeous creatures. So little Mocha here is behaving a little bit more like what you'd expect from a meat dog.
Yeah.
A bit more
Nervous
aggressive.
and a little bit of an aggression, yeah. So
Yeah.
I think we're going to have to be careful here.
Getting into the cage with Mocha and Jane, you can see that this dog is just quite fearful, quite nervous, and also a little bit reactive. And it's those dogs you can't read very well, and sometimes they go from fearful to aggressive. All right. Not stupid. You know exactly what this is, don't you? I mean, he's acting just like you'd expect a dog from a meat farm to behave. He's like, all people are scum, and I don't trust one single one of you. Hey? Understandably, that type of rope would have been the kind of thing that would have been put around other dogs that he would have seen back in Korea and would have been dragged out to their deaths. So clearly he's going to be worried about that.
Good boy.
Now, we're really sorry about that.
Good
okay?
boy.
We're not trying to do anything mean to you. No, we're not. No, we're not. Okay, so I'm just checking the fact that Mocha is definitely a boy.
And?
He is, but he's got a bit of an issue in that he only has one descended testicle.
Okay.
So he's a cryptorchid. So the other one, I can't feel it in the inguinal canal. So it means that that testicle is likely still in his abdomen. So when he gets neutered, we'll have to go fishing in there to try and find
it.
Remove it.
Good boy.
Although I've picked up a condition in Mocha that does need surgery, I just don't feel that his emotional state is strong enough for him to leave the supportive environment of the kennels. So I think it's best I leave him here in the caring and loving arms of Jane, but I will be coming back to pick him up soon. See, we didn't even need the muzzle. Hey? No, we didn't. No. Right, so who's next?
Most of the new arrivals are Jindos, originally bred in South Korea for hunting. So the next patient kennel manager Jane introduces to Scott
Hello, Jack.
stands out.
Hello, mate. Wow, well, that's a very friendly hello, isn't it?
Good boy. Should we go in and have a look at him?
Yeah, please. Hi, Jack. Jack is a very sweet little beagle cross. He's very chilled, very happy, very waggy-tailed dog. He's clearly an ex-pet dog that unfortunately got caught up in the dog meat trade.
So I had noticed with his left eye.
Yes.
I'd like you to have a look at that, please.
Yeah, I can see. So he's got a cherry eye, an enlargement of the gland that hides in the third eyelid. It's prolapsed out, becomes more irritated, gets larger, stays out. So it's probably very likely that Jack has had that his whole life, and something I can easily fix with a little bit of surgery, can't I?
Brilliant.
Yeah, but I can see also at the same time he's probably, are you an entire male? Yes. Sorry to do that straight away. A bit rude, isn't it? Hey? So we need to neuter you. We need to sort your eye out, and then we can find you a lovely new home. But he is not going to have any trouble,
I don't think
is he?
so. I think he'll be straight out.
Yeah. Jack's a really happy boy and far less traumatised than some of the others. All right, good boy, brave boy. So I think he's the perfect candidate for me to take back to the practice to give him all the procedures that he needs so he's ready for his forever home. There's my good, brave girl.
Before Scott heads back to Richmond with Jack, there's one last rescue dog to look at.
Lily just has no spark in her at all. There's no energy. There's not even any fight. I can hear her heart. Now we just need to fill it with some love, don't we? Yes. Okay, good girl. So now I need to vaccinate you. I'm so sorry. It is literally like having a soft toy that you need to vaccinate. She just doesn't react. She is just given up. She just doesn't know what it's like to be a dog, doesn't know what it's like to enjoy life, to be outside, to be loved, to be cared for, to be trained, to be fed. Just feel like you need to cuddle her for years and years to make up for everything that's been done to her, everything she's seen. We're sorry. It's going to get better. Yeah, well.
It's been an emotional day for everyone. And with all the rescue dogs now vaccinated, Scott is heading back to the practice with Jack for his eye surgery.
Jane, I will take this boy and you can look after the rest.
That's great. Thank you very much.
Come on, big boy.
See you soon.
Come on, let's go. Come on, you're keen, aren't you? Come on then, let's go. Good boy. Come on, lad. Can you come? Come on. Come on. Come meet the team.
At the Richmond Practice, Scott has arrived with Jack.
Come on. Hi, ladies.
Oh, who's this?
This is Jack. Guess where he's from?
I don't know, local charity or?
He's not a Richmond boy.
The Beagle Cross was one of the 12 dogs that have just arrived in the UK after being rescued from the meat trade in South Korea.
Come on then, let's go. Good boy. That's it.
Jack needs immediate surgery before the search can begin to find him a new home.
Not only do we need to neuter Jack in order for him to find his forever home, but also we need to correct something that he has called cherry eye. Basically, he has a small gland in the third eyelid which has prolapsed. And what I need to do is to encourage it back behind that third eyelid. And I do that by performing a procedure where I almost make a little sleeping bag for it, tuck it back in, and that inflammation reduces.
I don't think Jack's too impressed by the looks of it.
Assisting Scott today are nurses Nathan and Reagan.
Let's just give him a little pre-med. Here you go, boy.
Jack is far less traumatised than some of the other dogs rescued from South Korea, indicating he may once have been someone's pet.
Are you sleepy? Jack is a dog that's been in a dog meat farm and yet is finding solace and clearly joy in the arms of people. So it's quite heartbreaking in a way to think that this boy doesn't have a home, but you know what? He's going to get one quickly. He is adorable. All right, Nathan, so just start with the castration. He's okay?
Yeah, all good.
You're happy?
Yeah. How many of these do you think you've performed?
How many castrations do I think I've performed? Oh. Well, I mean, my first job was the RSPCA in Sydney, and we did 40 neuterings every day. And I was there for over a year, so thousands. Yeah, thousands. Okay, so castration all done. Reagan, can you roll in the other anaesthetic unit, and then we can get going on his eye. We just need to flip him around. Touch. So I can see really clearly the little cherry eye gland there. My job is to try and encourage it to go back where it needs to be, which is behind that third eyelid. Right. So I need you to give it a little bit,
more, okay.
tension there. So if you then flap back over, that's it. Okay. And that, my friends, is that. So all good. So we can take the sutures out. Yeah. And then that eyelid, once it's cooled down a little bit, that swelling will come down and you'll never know this handsome chap had a cherry eye. All right, let's wake this boy up. This dog was nearly food. And to think that that happens in the world today is just so shocking and horrifying.
Hey,
Hello. Hello, big guy. The fact that he still has love in his heart for people is incredibly humbling and reminds us all just how amazing dogs really are. All the horrible stuff's all done.
You can be rehomed.
That's right. Yeah. To someone who's going to love you very much. Just what you deserve.
At the Isleworth practice, vet nurse Lily is bringing in her pet hamster
Hello. Hi, Lily.
for a pedicure.
This is my hamster, Cricket. Hi, Cricket. Hi. Can I hold her? Yeah. Is it a girl? It is. Has she got enough bedding, do you think? Well, this is her burrow box. It's not actually her full cage.
Nurse Gina and vet Phoebe are instantly smitten with the lively little hamster.
Hello. She's very cute. Hello. She's very cute. Is she okay, though? Is there anything wrong with her?
She's fine, but her nails are starting to curl over, so I think they might need a bit of a trim.
Okay, we can definitely do that. Oh, yeah, I can see what you mean.
Yeah.
They've got a bit long and they're actually sort of twisting her toes a little bit.
A little bit, yeah. I changed Cricket's bedding over quite recently, and ever since then, her nails not wearing down as they used to. So they're starting to curl over, which can't be very comfortable for her.
Right, then. Let's put her back in and take her through. There you go. Now, don't go...
squash her.
Don't go hiding.
Come on in, let's go get you a manicure.
I've done nail clips in dogs and cats and rabbits. I've done them in every other possible animal I can think of, just never done them in a hamster before. So I'm a bit concerned that she's going to be really wriggly. And I know that also in hamsters, the stress of something like this can be quite dangerous. Their heart can stop and things like that.
Yeah, so she's quite happy being handled.
Yeah.
And she does come around the country with me, so she's used to stress.
But it clearly is something that needs to be done.
She's less reluctant to go on her wheel, certainly.
Yeah.
But she's still happily climbing all over the bars.
Oh, well, we can't have you not going on your wheel, can we? That's what hamsters are meant to do. She might be a bit more settled in your hands.
I doubt it. She usually climbs all over me.
These are the smallest clippers we have.
They're still about half the size of her.
Yeah.
Right.
We'll try our best.
Good girl, good girl.
There we go.
Got one.
Got one.
Sorry, good girl, good girl.
2. 3. I feel like you wouldn't be able to do this with that many hamsters.
No.
Right, how's that foot looking? So that's already made a difference to her walking, I can see, with the foot that we have done and the foot that we haven't. Lily, I'm very impressed with Cricket.
No, I'm lucky she was so friendly.
Yeah.
That's why I picked her. She was the only one who came to greet me when I went to pick one out.
Really?
Yeah.
Oh, that's cute. Right.
Paw number 2.
Let's carry on. Sorry, Poppy.
Cricky's doing really well. She's not squeaking as much as I thought she would, which can be a sign of stress. So hopefully we can get on and cut the rest of her nails quite fast.
One more foot. We really need some smaller clippers.
Don't think they do hamster-sized clippers.
No, I'm not sure they do. There we go. Done. I think I got better as we went along. Or maybe she just was putting up with it a bit better. There we go. So it's really nice when you can cut a hamster's nails like this because it clearly provides instant relief. So we can put her back on the table and her toes are now nicely aligned and I think she's a lot more comfortable. And although she's not looking happier, I can tell that she's happier.
Do you want a treat for going through that?
What's that? Oh, she's doing really good, weren't you?
Yeah. Handsome you are. I think you know you're handsome, don't you? And you know you're very cute.
At the Richmond Practice, Nurse Sam is spending time with Jack, one of the 12 dogs rescued from the South Korean meat trade.
Someone's coming to see you today. You might have a new home.
It's been just a week since he arrived in the UK to hopefully begin a promising new life. Today, Jack has some special visitors, Caroline and her son Alex and Basset Hound Snoopy.
Come on, boy.
The family has been following Jack's story and are interested in adoption.
We'd been following it on social media, so we'd seen Jack's story before he arrived in the country.
Hello, you're going to have a younger brother that looks not dissimilar.
No, he doesn't. No, not dissimilar. He's very lucky to have been brought over, to have been looked after. So, yeah, hopefully we can now be part of that as well.
Lovely. He's so wonderful, aren't you?
Although Caroline and Alex are keen to adopt Jack, they need to make sure he gets along with 9-year-old Snoopy.
What do you think, Snoopy? What do you think? Well, no reaction is better than an aggressive one, so I'll take that. That's fine.
He's quite chilled.
He's very nice. Well, maybe he's just quite discerning, so he just needs to get to know Jack a little more. You guys go and have a lovely walk in the beautiful green fields of Richmond. I really think that Caroline and Alex's family is going to be a perfect match for our little Jack, but we just want to make sure it's right.
Come on, Jack. Come on.
So they decide to take Jack for a little walk with Snoopy in the green fields of Richmond.
Snoopy's always a little bit aloof. He's 9.5. He's one of these dignified old gents. He's not quite as excited as Jack, but it all seems good. Very happy.
How's it going?
Good, really good.
Yeah?
I think...
Going very well.
They don't want to come back in. I think they
Jack,
might
is it
like
love?
each other.
Brotherly love.
Yeah, brotherly
Brotherly
love.
love.
That's what we're having.
I think the most important thing is that he's happy and it's the best thing for him. I'm really hoping it is.
Well, that's it. I think the two big pluses that you give Jack is A, you work from home.
Yes.
So you are there to be able to give him the long walks that he needs. He's still a young, energetic, exuberant dog.
Absolutely.
But also, he doesn't tend to be upset when he's with the companionship of another dog. And that's exactly what Snoopy's going to offer. So for us, I think we couldn't think of anyone more perfect to take him.
We're very thankful and very thrilled.
It's been a massive privilege to work with these dogs that have been rescued from the dog meat trade, and these are the lucky ones. And Jack particularly, he'll only know love from here on out. Good luck, guys. All the best.
Thank you very much.
Bye, Jack. Bye, Snoopy. Look after him for us. All right. Bye, guys.
Bye-bye.
See you later. Bye, Jack. Bye. See ya.
2 weeks later, Scott is returning to the rescue charity All Dogs Matter.
Hello, guys. Hello. Good lad.
He's back to see Mocha, one of the 12 dogs rescued from the South Korean meat trade.
Good lad.
Mocha has a condition known as cryptorchidism, where one of his testicles is missing from the scrotum.
Hello, Jane.
Hi, Scott.
This is all looking very promising, isn't it?
He's getting used to some pampering.
Hello, Mocha.
Doing really well.
Hey. Well, Jane, you've obviously been sprinkling your magic on this guy because he's quite the transformed character, isn't he?
Coming on really, really well. It's all right.
When Scott first saw Mocha, the little dog was deeply traumatised.
And he's acting just like you'd expect.
And too stressed to be taken back to the practice for surgery.
I'm not trying to do anything mean to you.
Scott predicted it would take intensive TLC to help Mocha come out of his shell.
So we've been getting used to handling him, grooming him, getting him ready for his forever home.
And he's at least accepting it now, isn't it? Whereas
Seems so much more relaxed.
he was quite a nervous chap. I remember us running around trying to get hold of him.
Exactly, yeah.
So it seems to me that he has developed a little bit more confidence since he arrived from Korea. Do you feel like maybe he's ready now to allow me to take him to the practice?
I think that'd be great. I think the trust is there and I think he's good to go.
Yeah, and we just need to jump this last hurdle before he can go to his forever home. It's got to happen sometime, my friend. Hey, you ready?
I think he's ready.
Yeah. Jane's an incredible person. She really is like a dog whisperer. She is so good with them.
Good lad, is that nice?
You see the way she moves with them and works with them. She really does garner their confidence, and clearly that's really worked with Mocha. Now, mate, I'm really sorry to do this, but I just want to make sure that what I felt last time in your male areas is the same. All right, so let me just have a little feel.
Good boy.
So we've got back here. So
good lad.
Last time, I could only feel one testicle in his scrotum, and the same applies today, I'm afraid. So there is just the one ball in the bag.
Right.
So the other one
Mocha
is likely to be in his abdomen.
Okay.
Still, so he would have been born that way, and he's classed as a dog with cryptorchidism.
Okay.
And that is a problem long term because that testicle will develop in a warmer environment, being in the abdomen rather than being in the scrotum, and that could mean he's opened up to, well, basically cancer.
Okay.
So it's better that we just take it out now that we know it's a problem, and then he can start in his new life.
So that's good that he's ready to go.
Yeah.
Good boy. Good boy. There we are, Mocha.
All right.
Off you go.
Go, all right, in there. Good boy, in you go. There we go. Good lad. All right. Right, see you soon.
See you soon. Good luck, Mocha.
Cuddles? Gizmo, come and have a cuddle with Mum.
Another one of Scott's patients will also be heading in to see him later today.
No reaction at all.
Grumpy Gizmo belongs to Sarah and David.
Hello.
Gizmo's our Persian cat, which is a rescued cat. And he's approximately 10 years old because being a rescue cat, it's difficult to age them.
Lately, the Persian rescue cat has developed a rather embarrassing habit.
Gizmo's got a sexual preference like me.
I'd rephrase that.
Yeah, well, how can you rephrase it? All he wants to do is hump me leg or me arm.
Gizmo, give it a bloody break.
As soon as I come home from work in the evening, sit down and watch a bit of telly, he's on me and tries to hump me stupid.
Yeah.
No. No. Pack it up. No. We tried schooling him for it to try and prevent him from doing things like that, and it just makes him worse.
Off you go.
Come on, Giz, call it a day. You've had enough of this. I'll go and tell your mother. That's it.
We were told he was neutered, so really it shouldn't be going on.
Gizmo, stop it. Now.
It's got to the stage it is embarrassing. All right, David thinks it's funny. I don't anymore. I don't think he would do it when anyone was here, but I wouldn't want it to happen.
Gizmo, stop it.
Sarah is so fed up with Gizmo's antics, she's booked him in for an appointment with Scott later today.
Pack it up.
Come on, beautiful. Let's go and show you off to the girls. Hi, guys.
Hello. Oh. Who's this?
This very handsome fellow is Mocha.
Oh, wow.
Yeah.
Scott has arrived at the St Margaret's Practice with Mocha. The timid little rescue dog is getting a warm welcome from receptionist Liz and vet nurse Jess.
He's gorgeous, isn't he? Looks a bit shy.
Yeah, he's still trying to take in everything that's happened to him, I think. He's probably never been in a room with, white walls and people that smile and things that we just take for granted, so he's just going to be nervous about life, aren't you, for a while? You're a lovely boy, aren't you? Poppy's like, yeah, that's what I think of people that are in the meat trade. Yes, come on then. All right, come on. Let's leave you up here, Poppy. Jess, you're with me.
See you later.
We don't know if Mocha's going to be fear aggressive. We've only seen him for today, so we have to gauge his behaviour.
There we go. Auntie Jess has got you.
He's a good boy.
Okay, thank you. Okay, this is a very funny noise. We'll start it over here.
Boy, he's a brave lad.
It's fine.
Just taking it a bit more slow and being more patient with him, because you can see in his eyes, he's just not sure about us yet.
Okay, so I'll just give you a little bit of this to make you feel a bit sleepy. Yeah?
It's strange, isn't it, that we get so many dogs and puppies that come in that have been socialised and been around families and people that aren't even half as well behaved as he is.
Much more of a handful. Yeah, you're incredible, aren't you? Yeah. I mean, we've been working and existing alongside dogs for thousands of years, so there's something in that. There's almost a genetic memory for us to get on with dogs and for dogs to get on with us. And he's just tapping into that, forgetting what he's seen before and appreciating what he's got now.
Mocha is now fully sedated and Scott can proceed with the operation.
It doesn't take a vet to see that there is only one testicle in that scrotum, and that is clearly incorrect. So what we need to work out is where's the best spot to go fishing? And we can work that out by just pushing this testicle upwards, and we can see when you push it upwards, you can see actually that is the testicle from his right. So therefore, the other testicle should be to his left. So that's my fishing spot right there. It's really important that we find this testicle because it is a bit of a ticking time bomb. When the testicle develops, it goes outside the body and into the scrotum, and it functions at 2 degrees below body temperature. When it's inside the body, it's 2 degrees above what it should be. That can then stimulate mutation, and the main mutation is unfortunately cancer. Okay, so everyone ready? Everyone happy?
Yep.
Yep, okay. First things first, I'm just going to cut through the abdominal wall just to be able to gain access to the abdominal cavity, and then I'm going to go fishing. So it's kind of like an ice fisherman, so they have to cut the hole in the ice first, and then they pop the line in and see what they can catch. So I'm basically just fishing around just to sort of see what I can feel, and I feel something testicle-esque, and I'm going to try and grab hold of it. Yes, there you are, you little bugger. Here we go, Reagan, look at this. Okay, caught one.
Oh yeah, look at that.
There it is.
It's quite small, actually.
Yeah, so it's just developed exactly where it shouldn't have. So as a result, it's just a bit abnormal, but left to its own devices, abnormality can turn into lots of nasty things, including cancer. So it's definitely a case of better out than in.
Yeah. Good catch.
Thank you. Okay, here we go. So there we have one testicle. So you can see it's a very abnormal testicle because normally that's all contained in a little bag, but actually it was all one long structure.
Baby ball.
Baby ball. All right, so that's done. Nice and neat. In and out, never knew I was there, like a burglar. Now I can remove the easy one. So there we go. You can see the difference then, Reagan. Yeah. So that's a normal testicle. All right, so that's that. All done. Cool. Castration completed. Our boy can wake up.
Cool.
Come on then, boy. Let's pop you back to bed. Oh, he's a good boy. Come on then. Come on. Good boy. Here we go. Let's pop you in here.
Mocha will sleep off his sedation before being returned to the charity All Dogs Matter, and the search can begin for his new family.
Okay, all right. You sleep that off. Fishing's exhausting, isn't it? Yeah.
Hello, guys.
Hey, Gizzy.
You got your boy back again.
Oh, my baby.
Yeah.
No.
Oh, your baby.
My baby.
What is it?
At the Richmond clinic, Sarah and David have arrived with Gizmo. Practice manager Maz has a soft spot for the frisky feline.
How's he doing? Is he all right?
Yeah,
not too bad.
He needs to have a quick checkup.
Oh, poor Gizzy.
Because he wants to hump me all the time. Honest.
I mean, you're not even that keen on David, are you? So
No, she hates me most of the time.
I can't quite believe that. Humping? Man, I wish I was a fly on the wall when Scott examines Gizmo.
I don't think he's had a gay cat before.
Some familiar voices. Hello, guys. You're all right. Hello, gorgeous. Mwah.
Thank you.
So,
Hello.
They've brought Gizzy in to see you.
Oh, my favourite ginger in the whole world.
Have fun.
okay.
Oh my God, you two are such trouble. Come on, mate, let's run. Let's run. Here we go. Every time Gizmo comes into the vet practice, we have a bit of a bromance. We have a huge cuddle. He purrs away, and I absolutely adore him.
Hello, my boy. Oh, dear.
I know. He doesn't like it.
But today, he really doesn't seem particularly happy at all.
Oh, dear. Got a right grumpy face on.
He's normally a bit surly, let's be honest. But we sort of put up with it and we love him. But he seems a bit grumpier than normal.
He is grumpier than normal.
Yeah.
Yeah.
He needs to be looked at. His hormones are running.
Oh, right.
As in...
His hormones are running. Well, he's neutered, so that seems an impossibility.
I don't think so. He's supposed to be muted.
He's supposed to be, but his behaviour doesn't come across that way, not with David anyway.
If I'm sitting in an armchair, he would try to do me arm. If I lay on the settee, he'd try and do me leg.
Come again?
Not amused that we're all laughing at it.
No, I think that's probably why he's grumpy.
I'm quite sure it is.
Does he just show that sort of attention to you and not you, Sarah?
Not to me.
Just me.
Not
just
to me.
Wherever.
Just David.
So I don't know if you can supply pills or something for him.
I mean, that's Daddy. That's just wrong. You know. Let's wind this back. What I want to do is just give him a physical exam.
Yeah.
All right, and just check him over. If I get you just to hold him around the shoulders, please, Sarah. I'm just going to sit down. I think it's really important that Sarah and David have brought up this complaint. With me, it is very strange behaviour, but sometimes when cats behave strangely, they're actually unwell. So I'm just going to have a little feel of his back. Okay. Does seem a little bit tender about me extending his hips there. Good boy.
You'd know that Persians do suffer a bit from arthritis.
Yeah, good boy. Now I'm just going to have a feel at his back in here just to see, make sure that he's definitely been neutered. Sorry, mate.
Oh, dear. It's the indignity of it, isn't it, Gizmo?
He's definitely been neutered. I think it's highly unlikely that he would have come from a rescue centre without them neutering him.
Yeah.
But here's the thing. Maybe he was neutered as an adult. And what that means is, unlike a normal young kitten that's neutered early, they don't know what it is to feel sexually active.
Yeah.
He, on the other hand, has had all the testosterone coursing around his veins, and he's just been a red-blooded male, and he wants to perform.
Continue, yeah.
It may well be that your boy is feeling sexually active, but you're what he fancies, and not you, Sarah, sadly.
Yeah, oh well.
There's two issues here with Gizmo. One is a behavioural issue that he is doing this inappropriate humping. The second is that he has a medical issue. He has some osteoarthritis in his lower back and his hips, and it's making him a little bit more grouchy than normal. So we're going to do two things. Your job is to not respond to his sexual advances, and you're going to avoid any shaking, looking at him, talking to him, telling him off. None of that. You're going to completely ignore him, but what you're going to do is squirrel away in between the cushions of the sofa that you sit on a little spray bottle of water and just give him one spray in the face. Cats hate being wet most of the time, but particularly sprayed in the face. So the reaction he'll have is of disgust, and that should immediately calm down his libido. And Sarah, for you, I know that you will empathise with the fact that he's probably feeling a bit sore. And he has a bit of arthritis, and I know that you suffer with the same condition.
He's uncomfortable.
We're going to try a course of anti-inflammatories, okay? So you're going to be my nurse, you're going to be my behaviourist, and together I'm hoping we're going to have a happy and slightly less inappropriate ginger cat.
Okay.
Sound good?
That's brilliant, Scott.
Yeah. All right, sounds good.
I'm very pleased that it's nothing sinister, that it's just something that can be controlled.
All right, and look, let's not judge. You know, he's a lovely cat regardless of who he loves. Okay.
I'll just get myself a dog.
Oh, thanks.
Good boy. And roll over.
A month later in North London, South Korean rescue dog Jack is relishing life with his new family and big brother Snoopy.
And down. Good down.
At the beginning, I was a little anxious. Obviously, I didn't know how his behaviour would be or how traumatised he would be. And he settled so well. I find it quite amazing how calm he's been, how comfortable he seems here. And it's lovely to see how happy Jack clearly is.
Scott performed eye surgery on Jack shortly after the beagle arrived from South Korea. And today he's making a home visit to see how well the little dog has recovered.
Hi, Caroline. How are you? Good to see you.
Nice to see you.
Mwah. Mwah.
You want to come in and
Yes,
see
love
the doggy?
to. Can't wait to see my boy. Oh, it looks like someone's having a rough life. Hello. Hello, my boy. How are you? It's looking like he's having a dreadful time.
Not too miserable, I don't think.
And first things first, let me have a look at your eyes. I mean, amazingly, you really just can't tell the difference between the surgical eye, which was that left eye, and the right. They look exactly the same. So a great result on that front.
Lovely bright eye.
The cherry eye is completely resolved. He's looking good. And how's he going with his buddy here?
Really good. Better probably than I thought. At the beginning, I was a little anxious. I wasn't sure that Snoopy wanted a little brother, but it's been great. They spend a lot of time just cuddling up on the sofa together. At the beginning, he would fall off the sofa. I think his spatial awareness wasn't great, having been in a cage for so long.
We're pretty small confines and flat.
I think so. And his back legs, the muscles were very wasted. There wasn't much muscle there, so he's getting stronger. If Jack is feeling playful, then Snoopy gets told he has to play, which I think is quite nice for the old guy.
Oh, that's wonderful.
Jack is just part of the family now. We wouldn't want to be without him.
You're a lucky boy. Yeah, you're one of the lucky ones. Yeah. Hey, you sure are. Yeah.
You gonna be a good boy from now on? Right?
As for grumpy Gizmo, The water spray and arthritis medications seem to be working.
You're not bothered about doing naughty things now.
He's no longer trying to hump David.
All you want is a big old cuddle, don't you? Yeah, that's it. Now you're relaxed, aren't you?
Much to the delight of relieved owner Sarah.
Gizmo is one big, cuddly, loving baby. And we love him. You're supposed to be a pedigree Persian pussycat. Look at you. Come on, let's dry you off.
And there's good news for another one of the rescue dogs.
Hey, Mocha, Mocha, Mocha.
In South London, Mocha is also enjoying a brand new life.
How are you doing?
Mocha's new owner, Mina, is also originally from South Korea and feels strongly about the abuse of dogs in her home country.
I always felt very bad about my culture and people eating dog meat. I always wanted to rescue dogs from dog meat farm, and that's why we adopted Mocha.
Good boy, good boy.
Mina's other rescue dog, Ellie, has been an ideal playmate for shy Mocha.
High five. Good girl. Ellie is a very affectionate dog, so if we sit on the couch, Ellie will come and Mocha will just copy her and he'll come and ask for pets. So Ellie is just Mocha's model. Sit.
But Mocha is still painfully timid and will need a lot more time to learn to socialize.
Mocha was just too scared about everything. And if you put on the lead and he thinks like, I'm going to do something on him, he will just sit on the floor and wouldn't move and just so scared. And so we tried to walk both of the dog together and then he was just completely okay on the lead. So we were so surprised. Wow, that's how he trusts dogs but not humans.
Mocha was deeply traumatized when Scott first saw him, so he's keen to check up on his progress.
That's it.
Hi there, Mina.
Hi, Scott.
How are you?
Good, how are you?
Very good. I like the way you're making happy little families
Yes.
here.
Mm-hmm.
They're both getting on so nicely. So who is this?
This is Ellie.
Hello, Ellie. Hello, gorgeous. How are you? And of course, Mocha.
Yeah, hi, Mocha.
Hello, beautiful. Walking up to Mina, I get to see the beautiful Mocha looking like a completely transformed character. There he is on a lead in a park in the middle of London with a little canine companion and a loving new owner. It's wonderful. Can you say hi to me? Do you remember me? Do you remember me? Oh, thank you very much. Oh. Hey, sit. Wow, so already got some basic training down, Mina.
Yeah,
Well done.
you can ask for kisses too.
Oh, I'd love to. Can I have kisses? Kisses?
Oh.
Oh, thank you. Even if you have to buy it, it's still lovely. Oh, that's amazing.
Yeah, I think Mocha remembers Scott and it looks like he's happy to see Scott again and he gives like a bunch of kisses.
So still a bit nervous of people, which is completely understandable. I mean, where he came from, he had no trust or faith in the people around him. So it's a whole process of relearning that people actually are quite nice. One of the things that Mina's concerned about is that Mocha really doesn't like people, particularly men, which is not a surprise considering where he's come from. So she just needs to continue to socialise him well, go out and about, meet lots of lovely dog owners, and hopefully soon he'll realise that not all people are bad. Yeah.
But he's completely trusts me right now. So every time he's scared about other strangers who just come and sit right next to me and he just thinks that I can protect him.
Oh, Mocha really couldn't be in a more perfect environment to be with a country woman, with another dog that we know that he loves, and all he wants is love, affection, and attention. And it sounds like that's what he's going to get with you.
It's been only 1 month, but I see like huge improvement on Mocha.
Kisses.
Oh.
Thank you. Thank you. Oh, good boy. Good boy.
And thank you so much for taking care of him. I really appreciate it. I do.
Oh, thank you. Well, I'm just so glad that I've been able to play a part, and now that he is in a happy family. I have massive respect for Mina and absolutely everyone who's been involved with rescuing Mocha all the way through to him having a loving new home. All those people are really fighting a great fight to try and end the cruel trade, which is the dog meat trade. Let's hope that it's over very soon.
Oh, that's so nice. Thank you so much. I love you too.